Good evening, ladies and gentlemen. I'm Mary Clark, Vice President for Programs for the Black Women's Agenda. On behalf of our President, Ms. Guinevere Catchings-Hass, welcome to the Black Women's Agenda Virtual Town Hall, BWA Talks, COVID-19, Current Situation, What You Need to Know. The Black Women's Agenda is an organization of 24 national collaborating women's organizations who protect and advance the rights of women and their families of African descent. We are pleased to host this event in collaboration with the BWA National Collaborating Organizations and Unicef USA. The town hall is one of our social media campaign activities designed to advance the efforts of the Center for Disease Control and Prevention and the U.S. Department of Health and Human Services. We Can Do This public health campaign. And the purpose of the campaign is to increase public confidence in the vaccines and slow the spread of the virus. I will now introduce our first panel of experts who will address what you need to know about COVID-19, not only in the United States, but also in African countries. Our first panelist, Ms. Renee Cunning, serves as Chief Philanthropy Officer for Unicef USA, where she is responsible for creating and implementing a cohesive, collaborative, and unified fundraising program supporting the world's most vulnerable children. Ms. Cunning has over 20 years of experience in development and has served in many positions in this field, including Chief Development Officer at the NAACP Legal Defense and Educational Fund, Chief Development Officer at Horizons National, and Director of Development at Mount Sinai. Welcome, Ms. Cunning. Our next panelist, Anne Maria Griffin, is Senior Director of Global Cause Partnerships at Unicef USA and team lead for the diaspora and multicultural programs. She is experienced in international development and foreign policy advocacy, working with think tanks and the House Foreign Affairs Committee on Capitol Hill. Dr. Griffin spent over 20 years living and working abroad in Africa, holding positions with major philanthropic institutions, including the Ford Foundation. After returning to the U.S., she served as Director of Program Partnerships at the U.S. African Development Foundation. Welcome, Dr. Griffin. Our next panelist, Nancali Muscu, is the Senior Advisor in the Chief Protection Program Group at UNICEF headquarters. She has almost 2 decades work experience in the East and Southern African region, including Mozambique, Zimbabwe, and Somalia, focusing on the realization of the rights of vulnerable children. Ms. Muscu is a fellow of the fourth class of the Africa Leadership Initiative in East Africa and member of the Aspen Global Leadership Network. Welcome, Ms. Muscu. Dr. George Benjamin, our next panelist, is a well-known health policy practitioner and administrator. He currently serves as the executive director of the American Public Health Association, the nation's oldest and largest organization of public health professionals. He is the former Secretary of Health for the state of Maryland. Dr. Benjamin is board certified in internal medicine, a master of the American College of Physicians, a fellow of the National Academy of Public Administration, a fellow emeritus of the American College of Emergency Physicians, and a member of the National Academy of Medicine. Welcome, Dr. Benjamin. Our next panelist is Dr. Virginia D. Banks. She is board certified in internal medicine and infectious disease, a fellow in the Infectious Disease Society of America, an active member of the National Medical Association, and is presently with the Northeast Ohio Infectious Disease Associates in Youngstown, Ohio. She is also the new chair of the George Counts Interest Group of the Infectious Disease Society of America and co-chair of the National COVID-19 Task Force of the Links Incorporated. Dr. Banks recently completed 15 years as head of infectious disease at University of Pittsburgh Medical Center Horizon campus in Hermitage, Pennsylvania, during which time she was named Clinician of the Year in 2014. Welcome, Dr. Banks. Our moderator for this panel is White House correspondent April Ryan. She has a unique vantage point as the only Black female reporter covering urban issues from the White House, a position she has held for 25 years. Ms. Ryan can be seen almost daily on CNN as a political analyst. She is also the Washington, D.C. Bureau Chief on the GRIO. She's an esteemed member of the National Press Club and is one of only 3 African Americans to have served on the board of the prestigious White House Correspondents Association in its over 100-year history. Welcome, Ms. Ryan. I will now turn the program over to you. Thank you.
Thank you, Madam Vice President. Thank you. Hello, everyone. It is so good to be with you this evening for this National Town Hall. I am the Change addressing COVID-19 here and now, the National COVID Public Health Education Campaign Town Hall. Tonight, we're going to talk about COVID, not just about COVID here, but COVID globally. And as you know, we are in a pandemic that has cost lives. It has cost so much to so many of us and beyond. And we want to get into this conversation, but first I want to give you some facts. The global health situation we're facing is certainly unprecedented because of the pandemic. BWA's previous informational events have featured experts who have highlighted the critical role of vaccines and encouraged African Americans to increase their uptake of the COVID-19 life-saving vaccines. Unicef is currently a leader when it comes to global health and vaccines, procuring vaccines for nearly half of the world's children under age 5. Let's say that one again. UNICEF is certainly a leader when it comes to the global health and vaccines, procuring vaccines for nearly half the world's children under age 5. That is huge, helping to avert 2 to 3 million children's death each year. We asked a team from UNICEF, UNICEF USA, and UNICEF to participate in this town hall to talk about the situation internationally, specifically in Africa, and how we can come together to strengthen global and domestic efforts to combat COVID-19. And I want to start off with Renee Cunning. Thank you and welcome. And I want to ask you, every moment of this is a story. Every piece of this is a story. What are some of the stories that stand out to you in the midst of this pandemic that's cost so many lives, not just here in this nation, but around the world, particularly in Africa?
Yeah. April, first and foremost, it's truly an honor to be here with you today and be a part of this distinguished panel. On behalf of Unicef, we are really proud to partner with the Black Women's Agenda for this important and informative town hall. I would be remiss not to highlight the tragic events that are unfolding in Ukraine as history continues to repeat itself. It's important to note that Unicef was founded 75 years ago in the aftermath of World War II. And now today, Unicef continues this core programming, as you described, to protect children's right, provide healthcare, access to safe water, sanitation services, education, emergency relief to the most vulnerable children across the world. And as you highlighted, we really want to talk about our work in Africa. I am so inspired by the breadth and the scope and the scale and the expertise as we are working to ensure that children are able to survive and thrive in more than 190 countries. There are several stories that really illustrate the magnitude of UNICEF's impact, and among them, the ones that stand out the most to me in particular are of women healthcare workers. Women who are not only the primary caretakers in their households, but who also go to great lengths to serve their communities. For example, Mutesi Joy, a Ugandan nurse, she travels 30 minutes by boat across a lake with a vaccine carrier box to provide COVID-19 vaccinations to a remote health center. Another nurse in Uganda, Judith Kandiro, she wakes up at sunrise to prepare breakfast and collect water from a nearby borehole for her family, all before she sets out to provide vaccines that are essential services at her clinic. And then there's the other story of the healthcare worker in the Democratic Republic of the Congo, who is not only responsible for keeping her own family safe, but is the sole healthcare worker for the community of 10,000 people. 10,000 people, April. Can you imagine this? And when I think about these stories, I always think about my mother who left me at night and served as a healthcare worker, as a registered nurse in Brooklyn night after night. But these ladies and these women are going to incredible lengths. And by vaccinating healthcare workers like Mutesi and Judith and supplying COVID-19 vaccine doses, UNICEF empowers women to continue to be the strong pillars in their homes and their communities by helping them to provide for their families and protect the hundreds and thousands of patients they serve. What an incredible ripple effect. And just last month, we delivered a shipment of 1.1 million COVID vaccine doses to Rwanda, which contained the billionth dose delivered to 144 low and middle income countries with billions of more vaccines on the way. Whether it's updating the cold chain storage facilities, installing solar powered refrigerators, providing training on the safe transportation of vaccines, to coordinating community outreach programs and all of the misinformation, UNICEF is working on all of these various fronts to help end the pandemic. And as you said, immunization remains one of the most successful and cost-effective public health interventions. And as the largest single vaccine buyer in the world, UNICEF has helped to reach more than 60 million children under the age of 5 with life-saving vaccines over the last 20 years, preventing more than 13 million deaths.
That's amazing, Renee. And I want to hit a couple of points real fast with you. Africa is huge when it comes to COVID. And we understand there are a lot of communities in Africa. I'm not talking about countries, but I'm talking about communities, some community areas that still are not as ready to jump in with the vaccine. What is that? What is that about at this moment? As they're saying, people still dying.
I think it's really, the misinformation, and it is also many communities, even here, our own personal family members that we know, I have them and you have them and all of us do, there is this vaccine hesitancy. What UNICEF is really good at is because we have these established relationships, because we have been vaccinating the world's children, and we continue to broker many of those partnerships to really break down and dispel some of the misinformation that is going on.
And lastly, with you on this really fast, because I want to go to the next panelist, but you brought up Ukraine, and all day I've been dealing with Ukraine. The last 2 days I've been dealing with Ukraine as a White House correspondent reporting on this. But we are connected. This world community is so connected. And now that there is a war on Ukraine from Russia with these missiles, you have people displaced, people hurting, being attacked, and people trying to find where to go. There are cash grabs literally right now at ATMs. People are coming together trying to find places to move to. But in the midst of a crisis like this, does this spread the virus? Does this spread this deadly disease as people are trying to run for their lives from this deadly warfare Russia's raining down on them?
I am not the medical expert, but I would say, obviously, once you have communities that are leaving and migrating and fleeing for their lives, we do know that more people who are getting together and large concentrations, then of course there is the likelihood that there will be continued spread of the virus, and we need to be very conscious of it because we're really trying to make sure that we cut it at the core.
Thank you so much, Renee. And Griffin, what can we do? What can organizations like the Links that I'm a member of, the Baltimore chapter of the Links, and so many other organizations, the Divine Nine, et cetera, what can we do to change the dynamic of the pandemic here in this nation and beyond?
Well, one of the things, and thanks April for that question, one of the major focus areas for us is how do we collaborate? I know that BWA has 24 national collaborating organizations. We really thrive on partnerships. We certainly look for the strength that comes with that. And a real issue with our work is miscommunication and misinformation. And so with collaboration and partnerships, we feel that information sharing is key because we raise awareness first, and then we provide support for the programs on the ground. So what can we do? We can work together, we can work collectively, and really do what we can officially and formally to come together. And I wanted to raise an issue related to the huge global we're part of, and that's something that's been quite effective. It's called COVAX, because a part of that information is vaccine equity and the importance of that. Looking that everyone is talking about no one is safe if everyone isn't safe unless everyone is safe. In other words, we must work together. So that's key to the messaging. That's important to the partnerships.
Yeah, COVAX. So, and I'm thinking about this global effort. I'm just thinking about what was just in the news. The UK is now talking about just living with it. Yes, we have COVID, we're just living with it. How do you live with it and still have the mindset, I've got to get vaccinated, I've got to continue to get vaccinated? This country is saying, oh, I'm just living with it now. And they're pulling back mandates. And yet we are still dealing with this. How do we do that when one country, a major world power, is saying that we're still trying to grapple with getting people vaccinated?
That's a hard question to answer. We can only work together and listen to the experts. I mean, I'm not an expert on infectious diseases, and some of the panelists might be able to answer to that. But I mean, a lot of it is just working together collectively, listening to the experts on the ground and really being part of networks that can be productive and constructive, where we're focusing on health, education, and gender issues. So it's really a hard question, a complicated one, but I think a lot of it relates to just our approach to networking, working globally and locally, making those ties and those combinations that will help to strengthen our effort.
And can we get a little granular on this collaboration approach in efforts to mitigate COVID-19 here in the United States?
Sure. Well, in terms of what Unicef USA is doing, of course, most of our work is globally, but we do have a number of projects that focus on children's rights and equity issues. Here within the United child-friendly cities initiative that we support, as well as our work on child marriage and other issues related to health in general. But two major pilot partnerships that we wanted to highlight today during the panel relate to work that the Arthur Ashe Institute is doing. We know that mental health is very, very significant and has certainly been emphasized as one of the ripple effects of COVID. So the Arthur Ashe Institute for Urban Health and the Johns Hopkins Center for American Indian Health are two projects that we focus on here at Unicef USA that is domestically oriented, working with young people through peer-to-peer leadership programs, focusing on strategies and tools and communication efforts that are a part of that addressing mental health issues. That's very important for us.
That's very interesting. Am I pronouncing your name right? Nancali Muscu.
Yes, you are. Thank you.
Amen. Amen. It's nothing like getting a beautiful name right. Could you talk to me, share some stories about African families being impacted by COVID?
Thank you. Thank you so much, April. We say that when a big problem throws one on the floor, little problems easily walk over the person. So prior to the pandemic, in the African context, women and girls had already been compromised by gender equality. And actually, that's not just in the African context. That's probably a global issue, but perhaps even more highlighted in the African context. So what was described for many as a new normal has actually been the backdrop for African women and girls' lives for generations. The COVID pandemic for us, kind of really brought a number of issues around structural inequalities across each sphere for women, from health to economy to security to social protection, all of them really increasing to make women and girls particularly vulnerable within the African context. One of the areas that I'd like to bring to your attention is around, for example, domestic violence. So even before the COVID pandemic, cases of domestic violence in Africa were amongst the highest globally. The patriarchal truth is that homes were often not safe for women or girls, and that is where most of them found themselves during the pandemic. So throughout the pandemic, we had more than 200 million girls across being subjected to sexual and physical violence by an intimate partner. In countries like South Africa, we saw the expansion of hotline services due to an increase in violence because women were locked down by their abusive partners. And in those situations, it was really sad to see that, 40% of women who actually experience violence don't seek any help for support or don't report the crimes. 10% don't even reach out to the police. That is the African context in which many women and girls were living during this environment. In addition, I'd also just like to highlight that we are living now in the African context in a world of economic stress, service disruptions, we've got parental death, all of these coming together to lead to an even more vulnerable situation for both women and girls and putting them at risk of even greater harmful practices. Thank you.
It's so interesting you talk about the fragile nature of women and girls in Africa pre-COVID and during COVID. And then during COVID, I mean, I'm sure everyone knows this, but it needs to be reiterated. During COVID, there was the highest number of domestic abuse cases in this nation because families were together. We were quarantining together, and fragile situations were made worse during those times. So I guess we mirror each other in a lot of ways in this moment. And I want to stay on women and girls, the mental health aspect. Talk to me about what you're finding with the mental health aspect with women and girls in Africa.
Thanks so much, April. And I've spoken first of all in the first half about women and domestic violence. Now I want to raise the issue of girls and mental health situations. We know that in a number of countries, in Africa included, schools closed down. For many girls, that meant them being brought back into their homes. And most people think that a girl being at home is a good thing. But for them, that meant that they were away from their peers. It meant that they were away from learning. It meant that they were away from being able to exchange with other people. And it meant that if they're in trouble, they don't have anyone to be able to reach out to. So girls find themselves by themselves. Just 2 weeks ago, April, we saw a country like Uganda opening up schools after 2 years. That means 2 years, girls were all by themselves. The longer that girls are out of school, the less chance of them going back into school. They become carers. They have a high risk of being exposed to child marriage and many other harmful practices. They're by themselves in that world. They don't get the opportunity to be a child. And the impact for that on their mental stability is such that, we could never be able to give back to them in many African countries today.
So there's such a educational, social impact with COVID, not just here, but it's a matter of life and death and a change in your life. Your trajectory is changed just from not going to school. Oh my gosh. This is a very important conversation. It's a very important conversation. And lastly, for the American audience, what should we do to support those women and girls in Africa? Because we do a lot of supporting of one another, but that's our motherland. What can we do?
Thank you so much for raising that, April. I mean, through Unicef, we've been able, and that comes from lots of contributions that come from the US. We've been able to provide a lot of support to women in Africa and many other parts of the world, which are also challenged. And through that support, we've been able, for example, to work with International Labour Organization to provide guidelines for businesses to support working families during the pandemic. Many families have been affected, and a lot of the vulnerability that you see taking place on women and girls is because of the economic impact. And so being able to bring those families back in terms of businesses, in terms of being able to support them to start up businesses has been great. UNICEF has also supported Planned Parenthood Association in various countries to build networks of health volunteers, peer educators, NGOs, you name it, to reach adolescent and teenage mothers in remote areas to provide care and support. One of the things that I really want to make sure that I highlight to you, April, is that in general, women and girls had already been vulnerable prior to the COVID pandemic. During the COVID pandemic, women who are even more vulnerable, so for example, women with disabilities or girls with disabilities, girls or women living in rural areas, the situation got even worse for them. So as we go forward, yes, we need to be able to support women and girls, but as we think about who we particularly need to reach out to, it's those who have, who are even worse off that we need to remember and put at the forefront in terms of who needs to be supported. Thank you very much.
Yeah, thank you. That's so interesting because every time I've traveled to Africa with presidents, one of the issues has always been women and girls. That is, as you said, that's a fragile community in many of the countries in Africa. And to hear that, it's just, whew, it touches your heart. It touches your heart. I want to go to another issue now that has been one of the biggest questions throughout this COVID pandemic: vaccines, pregnancy, and fertility. And I want to go to Dr. Virginia Banks. Dr. Banks, hi, how are you?
Good evening, and thank you, Black Women's Agenda, for having me, and it's a pleasure to meet you, Ms. Ryan. Thank you all for having me tonight. Let's talk about pregnancy.
Let's talk about pregnancy. Let's talk about the vaccine and pregnancy. And do we break it down by the Pfizer and Moderna in pregnancy, or do we break it down by all three here in the United States, J&J, or do we break it down J&J with pregnancy? How do we do it? You do it how you choose.
So I think right now we need to break it down in terms of vaccinations. We have 3 really good vaccinations that are available to us today. including the messenger RNA vaccines, and the J&J vaccines. And I think what is important, and we've vaccinated now. I think the last statistics that I saw were about 64% of the population has been fully vaccinated. That means 2 vaccines. So we have a lot of data now that we didn't have when we started this. The quick answer to this question is yes. All the vaccines are safe in pregnancy. And in fact, for those people that are not only pregnant, for those people that are thinking about getting pregnant or contemplating getting pregnant, the vaccines are safe. And there's some building evidence to show, more importantly, well, maybe not more importantly than getting vaccinated, but those women who are unvaccinated who get COVID while they're pregnant may have some increased risk for hospitalizations, severe illness, and also may impact their unborn fetus. So that's why, again, is the vaccine safe in pregnancy? Yes. I think you touched on fertility too.
Oh, yes, I did. That's a big one.
I heard that a lot, and I heard it from my friends, my daughter's friends, my girlfriends. I didn't know where this fertility thing came from. So I decided I was going to do my due diligence. And it appears that where it stemmed from was that, first of all, there's no evidence that the vaccines impair fertility. All right, let's start out with that. So how did this start? So there was an assumption that the vaccine could cause the body to attack this protein called syncytin-1. It's a protein in the placenta that shares a very, very tiny piece of the genetic portion of the spike protein. Everybody's heard about this spike protein. But the chances of that kind of confusing of the body's immune system to this protein that involves the placenta is so remote. I think it was described to me as confusing an elephant with a house cat just because it was gray. So that's just not going to happen. So there is no chance. There's no, at least to date. Now, a lot of times when we talk in science, I always like to say, as of February the 24th, 2022, at whatever time this is, but they're both safe in pregnancy, and no, there's no problem with fertility.
So I want to go a little deeper. I want to go dig into the weeds a little bit more. For those who are not vaccinated, particularly for men. Now, I don't know if you can respond to this or not, but there was a problem with their fertility or their efforts, if you will. If they were not vaccinated and got COVID, does that change a man's abilities from what we hear? I mean, this is an adult conversation. Everyone.
Right, sure. Those conversations have been battered around, and for those individuals that are not vaccinated, as we continue to look at this virus, it's probably the smartest virus. It's been around maybe since the Renaissance. And the issue of fertility, and the issue of men and their sexual activity and all of that, as we know now, COVID-19, SARS-CoV-2 affects almost every organ system. And so they're still looking at, issues. They found SARS-CoV-2 and spermatozoa fluid and so forth. So right now, there aren't any that I know of to date, major studies looking on male fertility issues and COVID-19 infection. But more importantly, men should get vaccinated.
End of story. Men should get vaccinated. Everyone should get vaccinated.
Everyone should get vaccinated, right.
But I get, when you talk about fertility and virility, I understand. Now, let's talk about this vaccination. Are we going to see a 4th vaccination? I mean, so for me, and I'm transparency here, and I did this publicly, I got the J&J. I was given the J&J vaccine, okay? But at that time, what did they say? You don't pick it, you get what you get.
You just get right.
Get what you get and be happy with it. So I had to be happy with it for the moment. And then I went to Moderna, which Dr. Kizmika Corbett, an African-American woman, was a lead researcher for Moderna.
Right, absolutely.
Yes. And so now for me, it would be a 3rd vaccine. But for the general population who received the 2 shots, are we going to see another? Do we need another? Is it going to be like the flu vaccine every year?
So, I've been in conversations recently with the Israelis who sort of started this conversation about 4th vaccines. And I had a conversation with them about a month ago where they started looking at giving 4th vaccines to individuals who are immunocompromised. And in fact, if you go to the CDC website, which again, tonight, everything that I'm saying is in alignment with the Center for Disease Control and the FDA. And the cdc.gov website is a wonderful resource for everybody with respect to COVID-19. CDC already has a list of individuals where the pharmacists or healthcare employees or pharmacists or whatever can give the 4th vaccine. And these include individuals who are immunocompromised, transplant patients, patients who are on a lot of those drugs that we see on television today where we hear about the good news about them, but then there's about a half hour of the side effects, some of the hematological abnormalities and so forth. So we already have a group of individuals in this country where the 4th vaccine is recommended for. I was just listening to Dr. Fauci this morning, and again, we're all trying to listen to the science. From what we know, as everybody knows right now, our immune system, our immunity is probably waning for those of us, most of us that got that booster. But at this juncture, I can say in February, March, we're not there yet, but we are truly looking at a 4th vaccine. And it may be that it might dovetail when we start looking at giving the influenza vaccine again in the fall, that there may be some evidence to support giving a 4th vaccine to individuals at that time, because we'll have a lot better data on the antibody levels and the immunity of individuals who got their third shot, 3rd vaccine.
And I want to go down this area, the long-term effects. Omicron came. We haven't really heard about long-term effects, but we heard about it with Delta. Talk to me about that, for kids, for people with diabetes, et cetera, et cetera. Right. Mm-hmm. Yeah.
So, with Delta, we certainly have a lot more information because it's been here longer. Omicron hit us about December, January. And so our information in terms of long COVID effects is not quite as great. But from what we know, at least looking at Delta and before that, yes, and as a matter of fact, I believe January the 14th, 2022, the Morbidity and Mortality Weekly Report, that's the news report from the Center for Disease Control, came out with a paper talking about looking at the increased incidence of diabetes, both type 1 and type 2, in those children who got COVID, SARS-CoV-2. So that was a really important piece of information because, it just sort of seems that every day we're learning more. So yes, that's been talked about. I'm sure everybody's now heard about heart abnormalities in younger kids, the myocarditis, the pericarditis associated in those children, adolescents who have been affected by SARS-CoV-2. So all of those, at least the good news about the myocarditis, that it seems to resolve quickly. We certainly encourage everybody to check with your cardiologist. I have sons and so and daughters that were involved in sports. And so everybody's concerned about that when you talk about, your kids going into sports. But I just heard a lecture a couple of weeks ago from a good friend of mine who's a pediatric infectious disease specialist. And this was good news. They did heart examinations on those kids who got myocarditis and pericarditis. And there's a test that we use to talk about the effectiveness of the pumping of the heart called the ejection fraction. And so when the ejection fraction was done on these kids that came in early with the myocarditis, it was low, but within a matter of 2 to 3 weeks, it was back to normal. So that was really, really good information. The brain fog is another thing that we're starting to look at, and it may be that the brain fog may simulate what we see as infectious disease specialists in viral meningitis. And there was a small study that came out that looked at the cerebrospinal fluid of those individuals that complained about brain fog. So what is brain fog actually? It is an impairment in cognitive dysfunction. So you can't remember, you have trouble learning things, those kinds of things that, I think about as I get older every day anyway. But these cognitive dysfunction abnormalities have been reported upwards of 8 months after being infected. And so this is another reason I want to stress vaccinations. Vaccinations are now approved from 5 and up. I encourage everyone to get their children vaccinated. Just if I can quickly mention, everybody's wanting to know who has young children. What about the ones that are younger than 5, the 6 months to 5 years? Hold on, it's coming. It's not a safety issue. It's just an issue about how many vaccines are going to be necessary for these children from 6 months to 5 years. We believe that the information will probably be coming out in April, so hold on. So when you talk about, Ms. Ryan, those long-term effects, that is why when individuals say, well, I'm not going to get vaccinated, I'll just get it. You don't want to get COVID-19 because you don't know what the long-haul effects are going to be from this disease. That is why vaccinations are so important.
We can put that statement right there on a loop and just listen to it all day, right, everyone? Yes, everyone's nodding their heads. Thank you so much. And before I go into Dr. Georges Benjamin, I got to say this. I was in the White House briefing room yesterday, and I was through the roof. I wanted to jump up and run. Someone behind me, before Jen Psaki came out, took his mask down in a room of all reporters and blew his nose. I turned around with my N90. Yes, they see those faces? I turned around with my N95 mask on, and he was like, I'm sorry, April. I was like, if I get COVID, it's going to be me and you. Dr. Benjamin, come on. Thank you, everyone. 'Cause I'm glad it's not just me. That was irresponsible. And Dr. Benjamin, they're talking about lifting the mandates everywhere. What in the world? Talk to me. Please help me calm down.
Let me just say, look, we are still in the pandemic.
Yes, we are.
We're not in the endemic. We're not going to be in the endemic phase tonight, tomorrow, or next month. We are going through a transition. So we've had 2 years of, in essence, 3, depending on how you count, maybe 4 big waves. The kind of 2 of the kind of the beginning, then we had the Delta, then we had Omicron. And clearly our society, which has gotten reasonably vaccinated, reasonably, I like to see us in the 80% for everybody range. And when I mean that, I mean up to date. That means 2 vaccinations and that booster shot.
And that's herd immunity. That's herd immunity if we get the 80%.
That's close to it. And then unfortunately, we have all these people that did get infected, which will contribute to the pool. But one of the things we do know is that the durability of both the vaccination and if you were infected doesn't persist for a long period of time. And which is why Dr. Banks talked about the issue about whether or not we might need a 4th dose. The people who are immunocompromised are eligible for that 4th dose right now. The rest of us may very well get it annually, like we get a flu shot, or every so many years, like we get a tetanus shot. But we're in a transition phase. So we're going to be moving from these big waves to episodic or recurrent outbreaks. So communities that are low, that don't have adequate numbers of vaccinations, people whose vaccine level has waned, we're going to get outbreaks. And so we should just prepare for those. And that means we're going to be going through a period of remasking, re-isolating, hopefully more narrowly, much more narrowly. And we need to plan for that effectively, because that's what we're going to be seeing. We're going to be doing contact tracing, testing, isolation and quarantining, and revaccinating much smaller groups of people as we go forward. And that's our future, probably for the rest of this year.
You see me looking at you, right? You said that's
absolutely
our future, probably for the rest of this year.
Let's go back. So my organization's been around since 1872. We were around for 1918. So I went into the archives and looked. And plus, I read all the books. I run John Barry's great book on the great influenza. Look, that thing was around 3 years. They don't talk about it, but it was around for years. In fact, the third wave was the most lethal wave.
Really?
Young people got up in the morning, were dead in the afternoon. Now, that's because of the way that virus changed. Right now, we've got a very infectious disease, but not as lethal, the Omicron variant, as the Delta or the Alpha variant. But when these things infect you, they make millions of copies of themselves.
Yes.
And they're so inefficient, they make mistakes. And those mistakes can be good or bad.
So, right. And every time someone is infected, that's a different variant, right?
It can be. It can be. You'll get, right now, Omicron's the big one. But there is another slight variant on the Omicron. I don't think most people right now think, again, just like Dr. Banks said, February the 24th, 2022. Right now, today, at this point in time, we don't think that it's certainly not more lethal. We don't think it's more infectious, but it could change.
So just to be clear, everyone, we've had thousands of variants, and you've only heard about the ones really that have really spiked in death and in sickness. And that was the original one. And then there was Delta, and Mu was in there, and Omicron. Am I right, Dr. Benjamin?
You're absolutely right. And those are the ones but look, scientists around the world are tracking hundreds of different variants of these things. They're only looking at the ones that are significant and relevant. And I know you asked a question about what's the potential in Ukraine and a war causing a big problem. And the answer is they're about 34% fully vaccinated there. They just started their booster program in January. And I won't make anything definitive about Ukraine except to say that put lots of people together with the disease in which you get from other people, whether it is the common cold, whether it is COVID, whether it is some other respiratory disease, whether it's a diarrheal disease, you're going to have an outbreak of something. And it's going to be a problem.
There's an outbreak there, and it tentacles throughout the world so fast, which we saw with Omicron coming out. The doctors were so ahead of their time and so ahead of the research everywhere else that they were the ones in Africa to tell us about Omicron. Now, are we going to be a society, you say a year, I'm going to be wearing my mask. They can take the mandate. They can say whatever they want to say. I'm going to be wearing my mask. I pride myself in the fact that I have not had COVID. No one in this house has had COVID because we have been wiping down. We've been wearing masks. And this is what I think, and just from listening to Dr. Fauci and Dr. Kizzmekia Corbett and listening to the experts and the scientists, we're probably going to be more of a summer people for a minute. And then maybe when winter hits, if this thing continues, we have to go back, as you said, to mask wearing and things of that nature. Is that what you're getting?
I think we're going to become a mask wearing society. The Asian folks in Asia have been doing this for years. And we used to chuckle. We would get on the plane and lots of folks in California and folks that were from Asia and many other countries in the world. I see Renee and her colleagues all nodding their heads, yes. They wore masks all the time. And we used to say, why are those folks wearing a mask? Well, we had almost zero flu last year. Partly because we got immunized and we wore masks and we washed our hands and we stayed away from each other. So yes, I am going to be part of a mask wearing society, and I will wear my mask when it's appropriate. Certainly when I'm around other people that, at least from COVID, that I don't know what their vaccine status is, when I'm around large numbers of people. But not all the time. There'll be times when I won't. I'm still when I go out in a restaurant, in an appropriate place, hopefully, I'll take our mask off when I eat, but it's going to go back on when I'm worried about it. And I advise everybody else to do the same thing.
I did just want to say, Dr. Benjamin, you were talking about, we weren't around in 1918. Shameless plug, my mother's 104. So.
Oh, wow. God bless.
Somebody was, okay.
Well, with that said, thank all of you. I thank all of you for this informative conversation. It is so important in the midst of this time of COVID a pandemic, a deadly pandemic. I'm your moderator, April Ryan, White House correspondent and Washington bureau chief for the GRIO, also CNN political analyst, and most importantly, a member of the Baltimore chapter of the Links Incorporated. Well, there you go. COVID-19, the current situation, what you need to know. Have a great evening.
Thank you so much. That was excellent. And, you know, every time we hear about these trusted voices, trusted messengers regarding COVID-19, most of us are inspired, and we learn something each time. Thank you so much. Thank you so much for Ms. Ryan for such excellent facilitation. And thank you, panelists, for all of the excellent information. Thank you. So now we will introduce our next panel. All right. We'll introduce our next panel. And I will start with our president of our collaborating organizations who have joined us tonight. Gwendolyn Lindsay, who is the national president of the Continental Society. Cornisha Brown, national president of Jack and Jill of America Incorporated. Quay Kelch Maddox, national president, Mocha Moms. Elizabeth Jones, national president, National Coalition of 100 Black Women. Kimberly Jeffries Leonard, national president, the Links Incorporated and the Links Foundation Incorporated. Donna Roderick, national president, the National Drifters Incorporated. Gwendolyn B. Lee, national president, the Society Incorporated. Rosie Allen Herring, Eastern Regional Director, Delta Sigma Theta Sorority. Rashida Liberty, International President, Sigma Gamma Rho Sorority. Nicole Baker, National Director of Social Action, Zeta Phi Beta Sorority. Christine Williams, National President, Auxiliary to the National Medical Association. Sarah Killian, National President, Chi Eta Phi Sorority. Deidre Stanford Scruggs, National President, Lambda Kappa Mu Sorority. Dorothy White, National President, Iota Phi Lambda Sorority. Sherelle Carper, National President, National Association of Negro Business and Professional Women's Clubs. Welcome. I will now turn the program over to our moderator for this conversation, Dr. Kimberly Jeffries Leonard, Vice President for Administration, the Black Women's Agenda. Welcome, Dr. Jeffries Leonard.
Thank you so much. Thank you. I'm so pleased to be here. So tonight I'm doing double duty. I am representing also the Links Incorporated, where I am the national president, but I'm also representing the Black Women's Agenda Incorporated as vice president for administration. And I'm thrilled to be sitting here with this panel of dynamic women who lead the 24 collaborating organizations that are really moving in this country and globally. So when we talk about the reach that these organizations have, what we're talking about is literally, they represent 2 million women. And when you think about the collective 2 million women that they represent, the reach into the community is mind-boggling. So what we heard on the last panel is that COVID is here. We need to take measures. It's not going anywhere. But what we have to do is be together on our messaging. We have to be together on our approach, because we are stronger together. Anne Marie of Unicef said that. And so we have organizations that impact in different ways and in different sectors of the community. So let's talk a little bit about what we're dealing with youth and families. And so we have the Continental Societies, Jack and Jill of America, Mocha Moms, National Coalition of 100 Black Women, National Drifters Incorporated, and the Society, who really do work in the community, either for or with children and families. So tell me, ladies, from the work that you do in the community, what do you see and hear from the community regarding the disinformation about COVID-19?
Well, I can start. I'd like to first say good evening and thank you for the opportunity to participate in such a critical sharing of information that is very important and timely. As our NCBW members across the country continue to bring awareness and education through our programs in health, education, economic empowerment, because we know that COVID-19 impacts all three areas, we are hearing and still witnessing persons that believe that vaccines cannot be effective because they were developed too quickly, that the government is placing microchips into our bodies, that vaccines do not prevent you from dying or getting COVID-19. We heard earlier about the belief that there is the vaccine causes a negative impact on female and male reproductive health and sexuality, and that Black and Brown communities are receiving inferior vaccines. And finally, people are just still confused about who to trust and what is fact versus fiction.
Well, that's a lot. And I think that when we talk about those kinds of misinformation, we certainly want to talk about the messaging. Are there other things that our family and children organizations are hearing as you continue to do the work that you do?
I'm Gwendolyn Lindsay, president of Continental Societies Incorporated. We're hearing the experts cannot agree on making mask guidelines. States and counties have different masking guidelines. The drug companies, based on continuous research, are constantly changing their guidelines regarding the vaccine. For example, Pfizer is now saying that those under 50 should wait a long period of time between the first and the second doses. And Republican politicians are making too many party line decisions versus decisions based on the data. We're hearing that all the time. And leaders are not really focusing on the least vaccinated and the most effective populations, which are the people of color. But people of color are always the ones that are being left out. And parents are not concerned about teachers and families and members and others who may become infected by lifting the school mask requirements. Many children live in households where adults are not vaccinated, thus posing concerns by other parents who are vaccinated. And under our 5-point program of health, education, employment, recreation, and arts and humanities, we continue to get out, making sure that the minorities are taken care of and being educated. And if they say we have to get another booster, I think many of us will get another booster. I think this is going to be around for a long time, and we must educate and elevate our children and our who all that we serve in our various communities. And we continue to do that by giving out the various masks. We also distribute COVID vaccine buttons, and we continue on a daily basis. The most important place where you can get the information generally is in the schools, and also in the churches. That's one of the most important places where we can get the information out.
Thank you. Gwendolyn, I'm sorry.
That's okay. Good evening. And I would like to thank the Black Women's Agenda and President Hess for having me and hosting such an important forum. Well, Jack and Jill of America Incorporated is an organization of mothers with children ages 2 to 19. And we have done our best to ensure that our members and our communities feel informed and empowered to keep their families safe during the pandemic. Now, we have consulted with experts within our organization, as well as partnered with the National Medical Association, as well as the U.S. Department of Health and Human Services to provide factual information. But as we know, our members and even our children sometimes gain access to information quicker than we can provide in some cases, and mostly through social media or other outlets. And in some instances, we have found that lingering distrust of the vaccine, just based on the painful history and experiences of our African American community when it comes to the healthcare system. But however, we continuously encourage our members to stay informed and to turn to reliable resources in order to make the best decisions for themselves and for their families. We encourage them to speak to their physicians and to get all the facts necessary to make informed decisions. We're all in this together, and we want to do our part to keep our communities safe.
Thank you. President Quay.
Hi, how are you? Thank you so much for having us here tonight. It's such an honor to be here. Mocha Moms has been on the forefront of action since the beginning of the pandemic. We've hosted and co-hosted many events to ensure we stay informed. We've hosted a forum on COVID facts and myths with special guest Dr. Melissa Clark. We created our national COVID policy for in-person chapter events, and we adjusted as needed based on the uncertainty of the times. We've included regular COVID updates in our weekly newsletter, Mocha Monday. We have a continued ongoing partnership with the Ad Council, and our Ad Council partnership is going to include weekly COVID corner updates. We've partnered with the Department of Education and the CDC on vaccinations, return to in-person learning, and what all parents need to know for them. Above all, we're talking to a lot of our mothers, and we know that a lot of our mothers and our families are leading their lives based on fear. They are stressed, they are full of anxiety, they are uncertain for themselves and for their children. Their mental health is suffering. We're very concerned about our mothers and their families. We know that they need support. They not only need accurate information, but they need consistent information, and they need love from all of us.
Thank you. Thank you. President Gwendolyn Lee, what are you hearing in the society as you work with communities?
Well, we're hearing basically the same thing. There's so much distrust and fear and a lot of anxiety. And it's also not just from the community, it's from our members as well, because most of our work is done, is hands-on. So it's done in school, it's done in the community. And so with our 4 creative areas that we have, literary arts, performing arts, visual arts, and instrumental arts and vocal, we need to be engaged and involved. And if you don't mind, I'll have to say this. So we had to take what was delivered to us, this COVID virus, this COVID pandemic, we had to try to turn it into something a little bit more positive. So we really went into this virtual community, full throttle. And so everything we did, we had to then do virtually. Well, that took a lot because we were having to teach people how to deal in a virtual world because they weren't used to it. But we were committed to our communities and we were committed to the children. And so we had to come up with something. So we just could not sit back and let it, threaten our existence and the work that we do with our communities. So we had to do a turn, and that turn has helped us to stay afloat. But we're looking forward to getting back into school, but very cautiously, because you see, every state has different rules, every state has different regulations. And so we too listen to the CDC as well as the AMA and all the state and local agencies. And I'm going to tell you this, every single one of them, with the exception of the CDC, something different. So you just don't know.
Thank you. President Donna, tell me what you're hearing.
Ma'am, how are you? I am so happy to be here tonight. And again, National President for the National Drifters Incorporated. And I'm echoing everything in my head and everything that I'm hearing tonight, because it is the isolation. It's the fear, it's the misinformation that it's across all of our communities. And one of our big things is that we believe in strengthening our families to build better communities. And how can you build a better community when you're isolated, you're doing virtual and Zoom meetings, and you have my congregation, my membership is a little older, so they're not as technologically sound. But I have found that it's brought us along. We've been able to have that sisterhood and to help our families and become that drifterdom that we are. And that has impacted us from the inside to the outside in other communities. So there's one thing I will say, COVID has brought us a lot further along technologically than anything else in the past decades.
You know, out of tragedy comes something good. And the thing that I love about what you all said is we're hearing a lot of the same things, and we have a lot of the same fears, and all of the communities and our members are really experiencing some of the same concerns. But what I'm also hearing from you all is that everyone is laser focused on ensuring that not only are we getting the right information out to communities by the initiatives, the phenomenal initiatives that you just talked about, but we're also trying to ensure that our members have the right information and that we're helping to turn the tide. And that is really the power of this collective. And I think that when we talk about Black women, we are the backbones of society. Now, you all, this group that I'm talking to now, you are focused on youth in your programs, and those and mothers of youth and families. So there's a lot of conversation, and we heard it about youth and the vaccines, and there are a lot of parents who are like, I don't know if I want to do that. But what we've heard from our experts and what we've heard from the trusted sources, vaccinations work. What are you doing to help your constituents feel more comfortable?
Making sure that events like this, making sure that we communicate to our entire organization and our families that there are events like this, that you can come and listen to the experts and not get information from different places.
Right. I would add, as already mentioned, we encourage our parents to speak with their physicians to get all the facts necessary. Everyone's circumstances are different, but the goal is to keep our children safe by sharing as much as we can concerning the vaccine, and especially when it comes to our unique organizations that are focused on the children. They are our future. We continuously share on our social media pages. We provide updated COVID-19 guidelines and offer webinars that are hosted by the experts, including a newly initiated Our Health Matters Task Force in consultation with medical professionals. So we want to keep our children safe so they can work, live, and play together. And we want our parents and caregivers to feel confident and comfortable with their choice concerning immunizing their children.
And we also want to make sure that the entire community is aware of what we do. We go out and we definitely do a lot of different things to make sure that our children are safe. We have the distributed COVID information for the healthy mothers and the healthy babies. We've also had many of our chapters to go on television with local TV spots and put everything on Instagram, all the social media things. It's important that they are aware. We've done videos for little children and mothers and parents and those who are affected on a day-to-day basis. We've also held a Healthy Me for us in order to go out. We've had a health wellness where we've brought in the top of the line African-American women to talk about we have to take care of ourselves first before we can go out and take care of others. Eating healthy, making sure that you are mentally fit and able to make sure that you can reach the children on a level that they are, and you have to be healthy in order to help others.
I wanted to echo that. In our organization, we talk quite a bit about self-care. We had a virtual national conference last year. The whole theme was self-care matters. This is all about self-care. So when we talk to our mothers about taking care of themselves, this is all part of it. And when you talk about being healthy, exercising, focusing on your diet, this is all part of it. So I think when you talk about it in those terms, they understand that. And also, we also like to play up the fact that self-care is sacred. This is a sacred act that we are doing for ourselves and for our families. And we need to make sure that they understand this is a high priority.
Thank you. Thank you. My sisters, thank you for your time. I'm going to switch up a little bit and talk to my Divine Nine sisters. Welcome, ladies. Glad that you all are here. So I just want a couple of questions for Eastern Regional Director Rosie, President Rashida, and Social Action Chair Nicole. So your organizations work with college students and young adults. And I know having my college student home was not only stressful for him, but it was stressful for me and my husband. But you all have a unique opportunity to be in these, to work directly with them and talk about some of the issues and problems that they're navigating both at college and when they come away from college as they're dealing with this pandemic. What are you all doing to address these issues with that unique population?
Sure. I think I'll go first. So thank you so much for the opportunity to be with you this evening. And I bring you greetings on behalf of our national president and chair of our board of directors, Sora Elsie Cook Holmes, who could not be with us tonight as she's traveling and literally in the airport as we speak, but I bring greetings on her behalf. And may I please, just a moment of personal privilege to all of the ladies who are here to thank you for your outpouring of expression, to all of us in Delta Sigma Theta for our loss of our 27th national president, Cheryl A. Hickman. So we do appreciate that, and we look forward to continuing the partnership. So to our president, Jeffries Leonard, as a link I get that into, I want to thank you for the opportunity simply to share that the work that Delta Sigma Theta does and has been doing for 109 years really has been exacerbated and brought to the forefront during this crisis. You know, we recognize that many of our collegiate students have gone through quite a bit, and many of them for their entire collegiate experience, for many, has been in this time of COVID. So it's been unprecedented. We've seen a lot of the mental wellness challenges that have come from it. Even our national second vice president, Sora Didi Kong, has shared that it's hard to simply be at peace. And so we understand that isolationism is real. This is a new normal for many, and that it is indeed a health challenge. So what we've done is done quite a few partnerships with organizations like NCNW, the National Council of Negro Women, and of course the National Pan-Hellenic Society as well, and that group on what we call our Good Health Wins. It's really providing online resources, webinars, town halls, and other technical assistance to various organizations across the country. So all 7 of Delta Sigma Theta's regions are all doing different things that bring to the communities the efforts around not only awareness, because in the previous panel, you talked about a lot of the myths that are out there. We certainly look to debunk those myths to ensure that our communities, which have been disproportionately impacted by this crisis, have the correct information as well as the access to those resources as well. So we will continue to partner not only with the groups that are here tonight, but with many of our external partners in being able to move this work forward. Thank you again for the opportunity to be with you tonight.
Thank you.
Yes, I'll go next. National Coalition of 100 Black Women shares her insight and lessons she's learned.
Okay, there we go. There we are.
Oh, okay. Well, good evening, everyone that is watching, and of course, this whole esteemed panel. I am happy to be in the room, and of course, I bring greetings on behalf of my president, Valerie Hollingsworth Baker. She does apologize for not being here tonight, but you are in good hands with me. Zeta Phi Beta Sorority Incorporated, for the last 102 years, we have, of course, been the forefront of many issues. And that is our premise with our program called Z-Hope. It's called Zetas Helping Other People Excel. And through this service umbrella, we meet the basic need. We work with youth, we work with families, undergrads, international women of color. So as the social action director, this particular project has fallen under my purview of working with the COVID and the flu pandemic. And like my sister Greek stated, we also partnered with National Council of Negro Women Good Health Wins. And what we have done with that partnership, we have hosted 3 national town halls to where we had the Surgeon General come and speak, and we had other professionals come and speak to talk about how to navigate this whole pandemic, from the miseducation that was spoke about to even just interacting with each other, because self-care has height, and we cannot neglect the fact, okay, get the vaccine, but understand, take care of yourself in general, mentally. And I think we all spoke to that in various capacities. But to directly answer your question, Kimberly, we had a town hall around September when most people go back to school, and it was focused around COVID and education. As an educator myself, I'm a little biased that we were the most affected sector out of all sectors within the world and within this country, because we had from preschool all the way through post-secondary institutions shut down. And now that they're slowly coming back, a lot of our undergrads are saying they're trying to hurry up and get vaccinated because they can't step foot on campus. So that's an anxiety that we hope starting next month, our National Director of Undergrads is going to address by hosting forums to put college students at ease on how to advocate for their care. Getting the right vaccine to where it doesn't cause an allergic reaction, understanding the facts with their own body health and body issues. And so that's mainly what Zeta is focusing on, is our youth and our undergrads. And with our youth, I just want to add, we have done PSAs where they speak to those that look like them. So instead of adults speaking about taking care of themselves, we're going to have our younger, soon-to-be Zetas speak in a PSA to say, wash your hands, take care of yourself, be mindful of what you touch. And just those little things will hopefully make the most impact along the way. So thank you for having me.
Those are really great ways to approach our younger sisters and our younger and the younger demographic. One of the things that we know we've seen also within our college and university students is issues around mental health. And so how are you all addressing that? I love Good Health Wins. I'm just shameless plug. The Links Incorporated is also part of the Good Health Wins process, the program. So it's doing so many things on so many levels. Have you tapped into Good Health Wins to address the mental health issues that we're seeing so much of?
Yes, we.
Go ahead.
No, go ahead, sister.
Okay. All right. And so within Beyond Good Health Wins, we are giving out grants to chapters, are creating programming around all facets of health. But we have a couple of Zeta-specific programs. Zetas have heart. So what our directors under that program is doing is having the members activate physically. Because that's another thing that has happened is COVID weight. I know we've heard that term thrown around, but people have psychological issues when it comes to their weight and their eating habits and their health habits in general. So that's one way we're combating it, is going to the body, work on your internal physical body. And then of course we have our mental health. And that's one of the top programs under this current administration, is to talk about more than just the blues. Because we know cabin fever is real. We know the isolation is real. So if we do this all around holistic approach of, okay, let's work on your physical, let's work on your mental, and of course the social with the Good Health Wins grant. That way we can, ease the burden of this pandemic. But what I've said in the many webinars and panels that I've been on internally, I've said, you know what? Use this time to take advantage of any project you may have missed out on. What makes you happy? Because at this point in time, what does it matter? It doesn't matter anymore of having the imposter syndrome. It doesn't matter anymore doing certain tasks or dealing with certain people. Use this time to release all that, to take care of you. If nothing else, take care of you.
Thank you.
However that may look. Yeah, give yourself permission to be you. So, that's what I've been preaching to the sisterhood in our internal webinars.
Thank you. Sister Rosie, what are you all doing?
Well, there are a number of initiatives. because we know that this is indeed a huge issue. And while we're certainly talking about many of our college students and our young adults, there are, challenges that literally abound and go across all age groups and across the spectrum. But in Delta, we definitely have what we call our Delta Care program. And in the Delta Care program, it's really around mental well-being and mental health. And it's when we utilize the theme, when Deltas are well, then all is well. And we ensure that we bring all that we can in terms of those resources, not just programmatically to those young people that we serve, but also to our young people who happen to be our members. And in doing so, we also make certain we look at what are the specific things that are needed, because we know that a one-stop approach does not necessarily apply to every situation. So we have an opportunity to do what we've done even grief sharing. Last night, I was on with a chapter in New Jersey that did a 2-hour session with an external facilitator around grief sharing, because there has been so much loss. And because we recognize that all of the things that are happening in society that we see are also happening to our members as well. And so we've been able to bring those resources, not only, again, externally, programmatically, but internally with our members as well. So those are just two of the examples, but we continue to refine that as needed and ensure that we're bringing something that is not only effective, but also meaningful to our communities that we serve literally across the globe. I will say just something real quickly. We think about COVID because we're Americans and we're in this country as something that is just for us. But this is something that is unprecedented, meaning that there is no part of society anywhere that has been untouched by this. And so when we think about many of our chapters who happen to be internationally, whether they're in the Arabian Gulf or in Africa and the like, or even Asia, we've been able to keep up with many of our members there and how they're dealing sometimes in expat situations as well as on military bases. And that's been somewhat of a forgotten group, if you will, because we focus so much on what's happened here in the US. And they are feeling the isolationism even more so because they can't get back and travel back to the States as often as they normally do. So we've been able to try to look at all facets of our society that we serve, as well as who we try to serve internally as well. But definitely our Delta Care program, because we really do believe, and our national president, Sora Holmes, really does believe that when all Deltas are well, then all really will be well.
Thank you so much for that. You know, you ended on a note that I want to use to bring our next panel to the forefront. There is no part of society that has not been untouched. And when we talk about our business and our professional organizations, I know you're seeing it there too. I know that you're seeing, you have members who are business owners, entrepreneurs. You have members who are frontline workers. So let's bring our sisters from the National Medical, the auxiliary to the National Medical Association, Chi Eta Phi Sorority, Lambda Kappa Mu Sorority, Iota Phi Lambda Sorority, and the National Association of Negro Business and Professional Women's Club to the virtual stage and talk a little bit about how these issues of vaccine hesitancy, these issues of COVID are impacting your members in their professional roles.
Hi, I am Dorothy White from Iota Phi Lambda Sorority, and I want to thank you for this opportunity to participate in this important forum. I want to address this, how the workers and the employees feel about this. Our organization is a business and professional women who are frontline workers, but not necessarily business owners. And we've held several discussions and webinars on the effect of COVID-19 and PTSD. Because we are frontline workers, some of our members, it has really affected them mentally and physically. We have open conversations on the pandemic and the trauma that it has imposed upon our members who are frontline workers, especially the respiratory therapists and the mental health workers. While caring for COVID patients, it can be emotionally draining, and the added responsibility of putting in the mechanical ventilation and intubating has really taken a personal toll on them, and it affects them mentally. And especially when there's no hope, and they have to disconnect the patient, and they're the ones who have to tell them that, there's nothing else that we can do, and take the tubing out. So all of that has been a real concern with our organization, working with our members. And then we have a lot of members who are mental health workers. And as one of the previous panelists said, domestic violence has really increased during this time. And so we have members who have to work with these cases, and they're working with women and children because of the isolation and all of this. It has really affected them, and they have no one. If they're in school, they can tell their teacher, but when they're home in this isolation, there's no one that they can talk to. So the mental health workers are people who are going in to work with them. It's stressful and it's traumatic even for them. And so, and I'm sure that as most of you have members who have been personally affected by COVID, and you lost personal friends and family members, and so have we. And many of our members also have had COVID, and some have recovered and some have not. So it has been a really difficult time. And so we try and focus on self-care for our members, giving them tips on how to decompress just by engaging in meditation and in physical exercise. We've even started prayer sessions and spa days. We have one respiratory therapist who says every 2 weeks, she has a spa day. She has to get away and just take that time to just decompose and decompress from all of that she's seeing every day. And as far as encouraging our members in our community to get the vaccine, we produced a COVID safety tip video. And we also did a PowerPoint presentation and a Facebook page where we showed I went out, got my vaccine, took pictures, and we put it on platform to encourage our members to go out. If I can go out and get it, then you can too. So we put that out there. And so one of the other things that we're doing is we have this health wellness project where we are encouraging our members to walk, to just walk. And in our newsletters, our monthly newsletters, we are putting in health columns every month discussing what to look for, how to take care of yourself, make sure you are that you are social distancing, that you're wearing your mask, because we have a very diverse membership. We go from the spectrum, from the young to the old. And so we have to be very careful on how we meet and how we work with our members. So that's some of the things that we've been doing in IOTA to spread the word and to take care of our own members.
That is so critically important. Thank you so much. So President Sarah, tell me what you're saying in Kitify and how you're supporting that your frontline workers.
All right. Thank you so much for having me. I bring you greetings from Kitify Sorority Incorporated, which is a professional nursing organization. And I must say that we do feel like we are a part of the change because we've continued to do education in the community with our partners, with our Black business owners, our small business owners. We're doing education, in-person education, as well as virtual education. We've had over 300 or more activities done, reaching approximately 200,000 individuals related to COVID over the last couple of years. Again, we're going into the barbershops, we're going into the beauty shops. So we feel extremely important. Even though we are frontline workers, we tend to continue to provide that service for humanity that we're dedicated to. So we've done those activities as well as assisted in decreasing the misinformation, decreasing the mistrust by being the faces and the people that look like the community that we serve. We build that trust, we do the education, we provided COVID kits for individuals with masks, with hand sanitizer, with disinfectants to help to mitigate the COVID vaccine, the virus. So we've done quite a bit. We've been entrusted to partner with the community and business owners. So that assists us as well as getting the word out. So we're still out there on the front line working in the community, and we love doing it. We think it's important, and we will continue to do it. And thank you again for having us.
Thank you. It is important work, and I want to thank you for all you're doing. Let me ask President Sherrill, tell me how it's impacting your members and what are you all doing about it?
Well, good evening, Sister Kimberly, and thank you so much for inviting us. This is a blessing for us to be here with all the other women organizations, and so I am so grateful. Our organization might be a little bit different from everyone else because the association right now, we're under a cease and desist order. We put out the order back in November 1st of 2020 when the pandemic was starting to have rise in numbers. So it caused our members to become more creative, more innovative, using more social media technology and looking to be more creative and thinking outside of the box. And it was a challenge, but because we could not meet in person, we had to find other creative ways for us to be able to continue to do our programs, our community work. And so that challenge, our members actually stood up to the challenge. So some of the things that we are doing for our business women and to intensify what they are doing as entrepreneurs, we published an electronic business directory for our members. We conduct a survey of our business women and to see how they are doing with their business during the pandemic. We have developed a monthly newsletter. It's called actually Sisters Resources, and it talks about grants, funding source, pitch competitions, and loans for them to be able to have this information available to them. The association headquarters started a job bank so that when jobs are published, we send it out to all of our members so that they, if those who have lost jobs or have lost their businesses, they can be able to have this additional information. The association started a sister business listing in our directory for outsourcing. We used to outsource a lot, but now we're starting to look within and look at our sisters that have those businesses, such like when we do webinars, like we had one last night on Real Talk about COVID. We use our sisters that have their own businesses and that are in technology as our program managers, especially now, you know, Zoom is everything. And so we look at those sisters who actually have their business and use them instead of outsourcing. We conduct professional development workshops. And through Zoom, a lot of our association business is held online. We became a referral service for our members. And through Zoom, our members can join other sister organizations and relying on behind how to come and sharing information. And so one of our businesses that I'd like to highlight is called Wise Healthy and is one of our members. She has a pop-up health facility in the San Francisco area. And Wise Health provides services to seniors and families, housing sites. They provide senior community centers and community fairs and information to schools and clinics during the pandemic. So we promote her business as one of our own through social media and other organizations that we can in terms of, as I said, promoting our own members. And that's one of our functions. And as far as the hesitancy, one of our clubs is actually partnering with Black Physicians Health Network, which is in Montgomery County. And they are getting out the information about vaccinations in the Black and Brown communities. So as I said, we have become more creative, more innovative, more thinking outside of the box from our youth all the way to our senior members. So we see this as a blessing to get the word out during the pandemic. We're taking the pandemic on. We're not fearing the pandemic. So we're using it as a benefit to our association. So we thank you very much for having us on tonight.
You know, I think that's so powerful. We're taking the pandemic on and we're using it as a benefit. And all of what you've said, all of our presidents who talked have really shown us how, you know, you pivoted, you addressed it. So let me ask President Dietrich, tell me what you're doing. How has it impacted, but how are you addressing it?
Hi, good evening. It's so good to be with all my sister presidents tonight. I considered it an honor to be among you all. I too echo the sentiments of all my sister organizations. We've had to become creative as well. I wanted to address minority-owned businesses and how we've been able to navigate this thing fiscally. And the one thing I just wanted to highlight was the CARES Act and the PPP. And although we have been grateful for that, but in some of our communities, the money wasn't divvied up the way it should have been. And many of us have been with our local banks for years, and we've sent our brown, green dollars there and we're not able to benefit from the PPP and the CARES Act. So I would ask that as we continue to go through this pandemic, that resources be made available to small businesses, especially businesses for women of color, because that is important and that's how we have been able to survive. Thank you.
So important, so important. We will make sure we remember that piece. Now, finally, last but certainly not least, auxiliary to the National Medical Association, President Christine, how has this impacted your members? What are you all doing about it? I think she's on mute. I think she may be on mute, but we will circle back. At this time, we'll circle back to President Christine. So there have been a couple of things that have come up that I think that we want to really take note of as we close this panel out with these amazing dynamic sister presidents who represent, let me say it again, 2 million, over 2 million members in their respective organizations, which means their outreach into our community is tremendous. We need to be making sure we're getting the right messages out. We need to be making sure that we're dealing with programs that are going to be impactful to our communities of all ages. We need to focus on our mental health. We need to focus on self-care. We need to address the business aspect of of how the pandemic has impacted us and look at policies that are going to be helpful to our community, such as the CARES Act and the PP and how that's going to support us. And then we need to look at things that we don't always talk about, like domestic violence and the things that the pandemic has really kind of pulled the cover off and made us have to see more. So this conversation has been very rich. I want to thank all of you for all you are doing, because if it were not for you, then I don't know where our communities would be as we continue to try to navigate the pandemic and the issues that were so eloquently explained and discussed in our first expert panel. So thank you, my sisters of our national collaborating organizations. Thank you again for the work you do. Thank you for joining us tonight. And at this time, I'm going to turn it over to Vice President Mary Clark.
Thank you so much. Thank you for this. This has been a phenomenal panel, and your moderation has been outstanding and engaging. Special thanks as we close. I want to give special thanks to our collaborators for this event tonight, the BWA National Collaborating Organizations and Unicef USA. And I want to also thank you, the audience, for joining us tonight. If you've learned a lot tonight and about COVID-19, you can get more COVID-19 evidence-based information by visiting the COVID Corner, which is on the BWA website. It will take you directly to the CDC website to get more information. Thank you so much and good night.